TCS Removable Flexible Partials offers a painless, life-lasting, comfortable, and economical solution for replacing missing teeth. The treatment is quick and non-invasive, with minimal discomfort. Most removable partials use metal clasps for retention. As natural changes occur in the mouth, the rigidity may cause it to rock slightly under mastication, damaging the enamel of the supporting tooth and even loosening it, which may require extraction. TCS flexible partials prevent this by distributing masticatory forces evenly over the entire supporting ridge, rather than relying exclusively on key support points. The partial flexes with the natural contours of the mouth as you chew. Since TCS flexible partials are tissue-bearing, they stimulate and preserve the jawbone to help keep it healthy and strong. The unique properties of the material allow it to engage undercuts in the mouth and use them as retention. The translucent pink shade blends in with natural tissue in the mouth, making them virtually undetectable. TCS flexible partials are very easy to care for. Placing them in TCS concentrated denture solution for 10 to 15 minutes a day keeps them looking and feeling like new.